Rotator cuff tears come in a couple of different flavors. There's the traumatic kind, so I fell down and slipped and felt a tear. And then the more common is the atraumatic or degenerative type of tear. We fix them the same way, and that's to sew them back down. We use special anchors and special suture to sew them back down to the bone, and then the bone has to heal. And it takes about 6 months to get through a rotator cuff repair, so it's kind of a long haul for about a 45-minute operation. Rotator cuff tears that happen with degenerative tears, the challenge with those is this is a biology issue. The tendon just wears out, kind of like treads on a tire. If you put enough miles on it, you're going to wear a hole in it. And that's where we see folks that come in with no trauma, 62-year-old who says, my shoulder started hurting 6 months ago. Primary care gets an MRI and it shows a rotator cuff tear. And they're like, how did that happen? It's just because it has worn out over time. There are things we can do outside of actually repairing the rotator cuff that can often help with the pain. And that's, most people's complaints are, it hurts really bad. It's rare that people come in and go, it doesn't hurt, it's just weak. And so we can often do things that can help with pain, but we're not able to manage and treat their strength deficits. And so there are functional implications if you're not able to fix the rotator cuff that become long-term. The other concern is rotator cuff tears will get bigger over time. So if we have a tear that's a single tendon out of the four, over time it may get bigger and involve 2 or 3 tendons out of the 4. And that can lead to a development of a special type of arthritis called cuff tear arthropathy. And then there's special surgeries that are required to fix that.